Hey, Dr. Ben with ViveWell Health. So when you first come to our place, we're actually going to measure you and see what's going on. Now, aside from the typical vital signs that you'll get at a regular doctor's office, we'll start off with a body composition analysis. This actually helps us to look inside to determine the amount of muscle, the amount of fat, and even the visceral adipose tissue, it's the fat that's actually behind the chest wall and behind your tummy. This is typically a starting place for people. They feel like they don't like the results, but we like to see it because it's a great baseline for the progress that you're going to make. So we tend to look at this as a metamorphosis, and we see people go from being a caterpillar to a butterfly. Next, we're actually going to come over here and on following visits, we do VO2 testing. That's where we measure your respiratory rate and your heart rate, and we actually see your metabolic function. So over here, we've got the resting metabolic table where you just kind of relax, and we see how much energy you actually burn when you sleep. Then we take you over here to the bike where we actually take you through your paces, and we find out your target heart rate zones so we can determine which exercise strategy is going to work best for weight loss or longevity or athletic performance. So for me, I had to change my iWatch here, and because a heart rate of 110 was actually the highest I could go when I was really trying to dial in weight loss. But then when I'm doing my interval training, I have to rev it all the way up to 170. So you're absolutely going to have different numbers, but that's why we check. So this is one of our procedure rooms where we perform regenerative therapies. The idea behind regenerative medicine is to do treatments that actually help the body regain its natural function. So whether it's joint pain or back pain or trouble with the pelvic floor or even aesthetics, we know the treatments to actually help the body harness its natural healing potential. One of my favorite treatments is inhaled hydrogen. It's so easy, you just have to breathe. So this machine right here, it uses electricity with water, and it makes O2, oxygen, and H2, hydrogen. So that bubbles up through here, through some water, and then you just go ahead and breathe it. Now, what does that do for me? Studies show that hydrogen, when it's inhaled, is a strong antioxidant and an anti-inflammatory. So the sneaky thing about it is that while it's getting you better, long after the hydrogen's gone, it's set a number of reactions in place. So we continue to have these anti-inflammatory pathways. So hydrogen is so good. It's on the ambulances in Japan and South Korea, and even over the COVID pandemic, the country of China approved inhaled hydrogen as a treatment for COVID infections. It works, and there's no needles involved. You're going to love it.
The gyrostem is a medical device, but it's a lot of fun. Okay, so what this guy's doing here is identifying targets and using his brain to have reflex coordination and agility as he's trying to hit the targets with the lasers. So this is a type of therapeutic stress that we've talked about before. In this case, the gyrostem is helping to create neuroplasticity. These are the new connections of brain neurons. So people increase their coordination and agility. The FDA cleared this device for the treatment of traumatic brain injury, concussion, PTSD, vertigo, and some types of strokes. Now, of course, anybody can use this device to get better. So we have people, athletes coming in, MMA fighters, or people who do racket sports, or hockey players, lacrosse, cricket, anything. Honestly, people use it for other aspects that require more attention. So we've got patients who come in seeking care for autism or even attention deficit disorder. So the opportunities are limitless for people.
Here we have one of our infusion rooms. So this is where we perform many of the infusions, starting from our ozone services to ultraviolet blood irradiation to inhaled hydrogen. So all of these are energy-based therapies because your body actually knows how to heal. So ozone, for example, back in the 1960s in Europe, they figured out that you could pull out some blood and add a little bit of stress and then send it back into people's bodies. And it would create this response where your body would create more antioxidants and push down inflammation and start other regenerative and healing pathways to get your body to use oxygen better. The idea of therapeutic stress is one that we all know about, right? You do push-ups, you hurt your body, and it comes back stronger. So this is what we're doing. We're using some energy and some great tricks to get your body to heal better. You're gonna love it.